The silent signs of stroke. You might miss. Know this? Save a life. They thought it was just stress or a skipped meal, but what was really happening was the brain shutting down, quietly, silently. Today, you're going to hear what most people miss, and it could save your life. He thought it was just a headache, a little dizziness, maybe dehydration. He sat down to rest. He never stood up again. Stroke doesn't always scream. Most people think a stroke is obvious. Face drooping, slurred speech, a dramatic collapse. But that's only part of the picture. Strokes can be silent, subtle, easily dismissed. The hard truth. Every year, about 15 million people worldwide suffer a stroke. Over 5 million die. Another 5 million are permanently disabled. Yet, up to 80% of strokes are preventable, and many people could have survived with early detection. Silent sign number 1, sudden vision loss or blurring. Strokes affecting the occipital lobe, located at the back of the brain, can lead to sudden vision problems. You may lose sight in one eye, see double, or experience blurry patches. These are not eye problems. They are signs that the brain is losing oxygen. Silent sign number 2, confusion or difficulty understanding language. If you suddenly can't process what someone is saying or you can't find the right words, your brain's language centers may be affected. This usually happens in the left hemisphere of the brain, particularly the Broca's or Wernicke's areas. It's often mistaken for fatigue or distraction, but in stroke, these symptoms can happen without warning. Silent sign number 3, dizziness and loss of coordination. The cerebellum controls balance and coordination. A stroke here can cause sudden dizziness, clumsiness, or difficulty walking. It can feel like vertigo or motion sickness, but with no clear cause. These cerebellar strokes are less common, but especially dangerous because they're frequently misdiagnosed. Silent sign number 4, numbness or weakness, especially one-sided. Even if it only lasts a few seconds, numbness or weakness on one side of the body is a major red flag. This is due to a blockage in the middle cerebral artery, the largest artery feeding the brain. Often, it's brushed off as fatigue or a weird sensation. That delay can cost everything. Silent sign number 5, sudden severe headache without cause. This isn't your usual tension headache. If you experience a sudden explosive headache, especially accompanied by nausea or vision changes, it may be a hemorrhagic stroke. That means bleeding in the brain, often caused by a ruptured aneurysm or uncontrolled high blood pressure. The brain has no pain receptors, but when pressure builds from internal bleeding, the pain can be devastating and fast-moving. Why every second matters. The science. When a stroke happens, brain cells begin to die within minutes due to lack of oxygen. In ischemic strokes, the most common kind, a clot blocks blood flow. In hemorrhagic strokes, blood leaks into brain tissue, causing swelling and damage. The human brain contains about 86 billion neurons. Every minute without treatment, you lose roughly 2 million of them. If treated within 3 to 4.5 hours, medications like TPA can dissolve clots and restore blood flow. But after that, the damage becomes irreversible. The message. Everyone needs to hear. Stroke doesn't always come with flashing warning signs. It doesn't always come with drama. Sometimes it comes quietly. Confusion, a moment of weakness, a strange feeling in your arm. That could be your only chance to act. What you can do right now. Learn the signs, share the signs. The fast method is simple: face, arm, speech, time. But also remember the silent ones: confusion, balance issues, vision loss, and headache. You now know something most people don't, and that makes you powerful. Share this video. Teach someone today, because stroke may whisper, but you don't have to. Now you know the truth. The signs they don't show in movies. The signs no one talks about. If you learned something today, share this with one person you care about. One message can save a mind. Don't wait. Don't guess. Recognize stroke, even when it whispers.